Magandang araw sa inyong lahat and welcome once again to another pre-recorded video lecture for the subject NCM 107 or Concepts in Pediatrics. I am Jeffley Reboron, isa akong nurse midwife at clinical nurse educator, and I will be teaching you about the Apgar Score. So please bring out your handouts so that you can follow along our discussion. Let's start! Gaya nga ng sinabi ko kanina, napaka-importante ng Apgar Score because it is a quick assessment tool that is used by healthcare providers like midwives and nurses typically within the first few minutes after the baby is born because we want to evaluate the newborn's overall physical condition and we also want to determine if any immediate medical intervention is needed. Kasi sasabihin ng Apgar Score kung may kailangan ba yung bata and kung mayroon bang kailangan gawin yung mga midwives and nurses to help the child recuperate. Now, what is the purpose of the Apgar Score? The Apgar Score, like I said, is a quick and simple assessment tool that is used to evaluate the physical condition of the newborn immediately after birth. And it also helps healthcare providers like us to identify any potential issues that may require immediate medical attention or intervention. Now, napaka-importante po ng timing sa Apgar score. The Apgar score is typically assessed, like I said, at specific time points after birth. Yung una is on the first minute of life, the fifth minute of life, and yung mga cases wherein we need to resuscitate the child, gagawin din po natin ang Apgar score on the 10th minute of life if it is necessary. Now, on the first minute of life, the score provides an initial assessment of the newborn's condition shortly after birth. Ito po yung kinatawag natin kanina na immediate well-being of the neonate. While the fifth minute Apgar scoring assesses how the newborn is responding or adjusting to any initial interventions or how well the newborn is adapting to the extrauterine environment. Yung 10th minute Apgar score naman po is used when ongoing concerns exists and additional evaluation is needed. Kunwari, nagkaroon kayo ng resuscitation sa isang bata na pinanganak na hindi masyadong okay or pangit yung kanyang Apgar score. You have to also perform not just the first Apgar score on the first minute of life, gagawin nyo po ulit yung Apgar score on the 5th minute of life. But since the newborn was resuscitated, you also have to continue monitoring and doing the Apgar score on the 10th minute of life. Now, the Apgar score assesses 5 key criteria and each of them is scored from 0, 1, and 2. Gaya nung sinabi ko kanina, kailangan natin i-check yung kanilang apical pulse, respiratory effort, muscle tonicity, reflex irritability, and color. So, i-grade po natin ng 0, 1, and 2 yung mga different criteria na to depending of course on the assessment findings that we get in our patients. Now, the higher the Apgar score, the better the overall condition of the newborn. At the lower the Apgar score naman po na makuha natin sa ating mga patients, the worse po yung condition ng bata. Alright? So that is your Apgar score. Now, let's have a look. Let's focus on the different criteria so that you will know how to properly give Apgar scoring to your patients. The first thing that you need to assess in Apgar scoring is what we call the apical pulse or checking the heart rate of the neonate. If the neonate's heart rate is undetectable, there is no heart rate that you can hear using the stethoscope, you give a score of 0. But if the heart rate is less than 100 beats per minute, you can give the child a score of 1. But if the child's heartbeat is more than 100 beats per minute, you give a score of 2. Now, what do you do in case the heart rate is below 100 beats per minute or undetectable or wala kang marinig? Now, we nurses and midwives should now initiate immediate resuscitative measures such as chest compressions or positive pressure ventilation. So, kailangan na po nating mag-CPR sa ating mga pasyente na mayroong undetectable na heart rate or less than 100 beats per minute. Bakit po? Kasi kailangan na po natin na paganahin yung kanyang puso or else the child may not survive. So you have to remember that resuscitative measures such as chest compressions or hooking the child to positive pressure ventilation as per neonatal resuscitation protocols is important during this time. But if the heart rate is above 100 beats per minute or may 2 points po yung ating neonate sa Apgar score, there is no need to give them these kinds of interventions. No immediate interventions is needed in this aspect pag meron po siyang more than 100 beats per minute. After checking the apical pulse, the next thing that you need to assess is the respiratory effort of the neonate. You give a score of 0 if the baby is not breathing at all or if the baby there is no rise and falling of his chest. You can give a score of 1 if the baby has weak or irregular breathing or there is a weak cry. You have to remember that crying is a sure sign of breathing. Pero kung weak yung cry ng bata, you just give a score of 1. That means that the breathing is not that fully established. You also give a score of 2 if the baby's crying is vigorous and very loud, or they have a good respiratory effort. So that deserves a score of 2 in the Apgar scoring. Now, what do you need to do if there is irregular breathing or an Apgar score of 1, or if the baby is not breathing at all, or there is an Apgar score of 0? You have to remember that as nurses and midwives, you should provide immediate assistance with positive pressure ventilation and any other respiratory support measures. We can now give, for example, oxygen via cannulation. We can also do suctioning to remove secretions that are present in the mouth or in the nose of the child so that they can breathe properly. So ito po yung mga pwede nating gawin kung 0 or 1 yung score ng ating mga patients in the respiratory effort aspect of the Apgar score. But if the baby is crying vigorously or there is a score of 2 in the Apgar score, there is no immediate intervention necessary for this aspect. After checking the apical pulse and the respiratory effort of the neonate, you also have to check their muscle tonicity. Lagi niyong tatandaan that newborns normally will be delivered na naka-fetal position or naka-full flexed position po sila. Now, if the baby has good muscle tonicity and they are exhibiting active movements in the upper and lower extremities, or kung sila ay naka-well flexed, you can give a score of 2. But if the baby has some flexion on the extremities but appears somewhat floppy, medyo may konting flexion sila or may mga ganong pag-fold ng kanilang extremities pero hindi ganon ka ganda yung kanilang muscle tonicity, you can give a score of 1. But if the baby is limp or flaccid, you give a score of 0. Kung medyo lantang gulay po yung itsura ng bata na naka-extend lang yung kanyang upper and lower extremity, then you can give a score of 0 po kasi flaccid po yung bata. Now, you have to remember that if the baby has poor muscle tonicity, meron siyang score of 0 to 1 sa kanyang Apgar score when it comes to muscle tonicity, we nurses and midwives should stimulate the baby and provide gentle tactile stimulation to encourage active movement and muscle tone improvement. So, mai-improve po natin yung 0 to 1 na Apgar score niya when it comes to muscle tonicity by stimulating the baby, rubbing the baby's back, or encouraging the child to move para po mag-improve yung kanyang extremity flexion. So that is what a nursing and midwifery action that we can do if we see babies with 0 to 1 na muscle tonicity. The next thing that you have to assess in your Apgar score is what we call reflex irritability. And dalawa po yung gagawin natin if we want to stimulate the child and see if there is reflex irritability. Pwede po tayong mag-insert ng suction catheter on the nostril, or we can also slap the sole of the foot of the child. That is how we can check the reflex irritability of our patients. Now, if you inserted a nasal catheter on the nose of the child or you slap the sole of the foot of the child at yung bata ay umiyak, nag-cry, nag-cough, nag-sneeze, or he withdraws the foot, then the baby shows na meron siyang strong grimace, meron siyang coughing or sneezing, ibig sabihin po maganda yung kanyang reflex irritability, you can give a score of 2. But if the baby exhibits a weak response or facial grimacing lang, parang gumanon lang when you inserted a nasal catheter or you slap the sole of the foot, gumanon lang, meron lang siyang slight na facial expression, you can give a score of 1. But if the baby does not respond to any stimulus or deadma lang siya sa mga ini-insert mong catheter or pag-slap mo sa kanyang foot, you give a score of 0. So, ibig sabihin po, absent yung kanyang reflex irritability. So, what do you do? If you see a child with no response at all after providing them with stimulation or meron silang Apgar score sa reflex irritability na score of 0 and 1, the nurse or the midwife should gently stimulate the baby. Gusto natin po na stimulate natin yung bata so that we can elicit a reaction. So what do? We can gently rub the baby's back to stimulate them to cry, or we can also gently flick the soles of the feet of the child. We can give them these kinds of sensory stimulation para po maka-elicit tayo ng response. Yun po yung gusto nating mangyari in the reflex irritability if our patients have 0 to 1 Apgar score in this kind of reflex irritability. The last thing that we have to assess in Apgar scoring is the color of the neonate. Now, the newborns are normally born completely pink. So, if the baby's skin color is pink or normal for the baby's age, you can give a score of 2. Kasi yun naman talaga yung itsura ng mga bata kapag sila ay pinapanganak, color pink po sila. But if the baby's skin is blue or pale with pink extremities or meron silang acrocyanosis wherein the body is pink while the upper and lower extremities are color blue, ang tawag po natin doon ay acrocyanosis, you can give a score of 1. Ang acrocyanosis po, nangyayari ito sa mga neonates natin normally because they have a very viscous blood. So, malapot po yung dugo nila because normally newborns are born with slight elevated hematocrit and meron silang polycythemia, kaya po yung dugo nila ay medyo viscous. That's the reason why ang mangyayari po is mahihirapan po yung kanilang puso to pump the blood to the different parts of the body, specifically in the periphery. Kaya po, ang priority po ng ating puso is to supply the abdominal organs po kasi ito po yung pinaka-developed na circulation natin, ang central circulation. Kaya po, ang mga bata na patients natin, pinapanganak silang with acrocyanosis because they have more mature central circulation and immature pa lang po yung kanilang peripheral circulation that becomes now the pink body while the upper and lower extremities are blue. Ang tawag po natin doon ay acrocyanosis, and if you see that in your patients, you give them a score of 1. But if the baby's skin is completely blue or completely pale, that is already cyanosis and pallor, abnormal na po yan, you can give them a score of 0. Now, if the baby has bluish or pale skin color or meron silang Apgar score of 1 or 0, the nurse or the midwife can assess for and address any issues that are related to oxygenation and circulation. Lagi nyo pong tatandaan na that the color of the child can give you an idea of how their breathing and their circulation are. So kung maganda po yung paghinga ng bata or kung maganda po yung kanyang circulation, maganda din po yung pinkish color sa balat ng bata. But if the child has problems when it comes to breathing or circulation, then nakikita po yun sa ating balat through cyanosis or bluish discoloration on the skin. So what can the midwife or the nurse do? Ang pwede pong gawin ni midwife or nurse to address the change in the color of the child is to provide ventilation. So, pwede po nating i-rub yung back ng bata para siya ay makahinga. We can also give them oxygen via cannulation or venturi mask. We can also provide them warmth or i-thermoregulate po natin yung ating mga pasyente. And like I said, administer oxygen. After performing the Apgar score, the next thing that you need to do now is to add all the scores in the different parameters that you have checked in the Apgar scoring, including the scores in your apical pulse, respiratory effort, muscle tonicity, reflex irritability, and color. So, i-add po natin lahat ng mga scoring na naibigay natin sa mga different areas na ito, and we will now be interpreting the actions that we will need to do based on the score, overall score of the neonate. So, kung yung newborn po natin ay merong Apgar score na 1:3, ibig sabihin the newborn is in serious danger and the child may need resuscitation. So, what will we do? We have to do CPR or cardiopulmonary resuscitation. We can also do suctioning and giving medication. So, like I said, kailangan po nating i-activate yung ating coding para po mabigyan ng resuscitation itong mga batang ito because they are in serious danger if they have Apgar score of 1:3. Now, these newborns with an Apgar score of 1:3 may need immediate medical interventions like your CPR, and actions may include initiating, like I said, neonatal resuscitation protocols such as positive pressure ventilation, magbibigay din tayo ng chest compressions, and administration of medications if necessary. Now, the newborn may also need to be transferred to the Neonatal Intensive Care Unit or the NICU for further evaluation and specialized care. So, ang gagawin po natin is itatransfer na po natin yung ating mga pasyente from the delivery room towards the NICU para po mabigyan siya ng proper care and monitoring. But, if the patient's Apgar score is 4 to 6, that means that the condition is guarded. Now, ibig sabihin nito, the child or the neonate may need supplementary oxygenation and clearing of the airway. So, what can we do as midwives and nurses? We can give this child with an Apgar score of 4 to 6 oxygen via face mask or cannula. So, ano yung mga gagawin natin? The baby or the neonate with a score of 4 to 6 may require some assistance and additional monitoring. Actions may include providing oxygen, stimulating the baby to cry or rubbing the baby's back, or addressing any specific issues that are identified in the individual Apgar criteria. So we can give respiratory support for low respiratory effort of the neonate. Also, kailangan din natin to closely monitor and observe these kinds of patients because their condition may worsen after the 5th minute of life. So, kailangan po nating minomonitor po sila because like I said, even if they have almost a passing score in the Apgar score, that is not a good score pa rin. Okay? So, 4 to 6, the condition should still be guarded. Pero kapag yung neonate or newborn nyo po ay merong Apgar score of 7 to 10, it means that the condition is good. So, ibig sabihin nito, there is no immediate intervention that is necessary. Wala po kayong kailangang gawing resuscitation, chest compressions, hindi nyo po kailangang magbigay ng gamot, hindi nyo kailangan magbigay ng suctioning or oxygenation, wala pong kailangan gawin because the baby is fine. Ang ibig sabihin niyan, the baby is considered to be in excellent condition. But what do you need to do? Still, you need to continue routine postnatal care and monitoring to these children. So you should still perform the Apgar score on the 5th minute of life because there is a possibility again that the child's vital signs may also fall or degrade after the 5th minute of life if the child has troubles adjusting to the extrauterine environment. Aside from the Apgar score, you also need to know and check the vital signs of the neonate. So, kailangan pong alam natin yung mga normal limits ng neonatal vital signs so that we will know and we can detect and we can report the abnormalities in their vital signs. Now, ang una po nating i-check is the cardiac rate or the heart rate of the neonate. Always remember to use the apical pulse of the neonate. Ito po ang ginagamit natin. The apical pulse or yung heart rate po ng bata. By using a stethoscope, we can check their cardiac rate. Now, the apical pulse is located lateral to the nipple line at the 4th intercostal space dito po sa left side ng ating chest. Dito po natin mas naririnig yung apical pulse. You have to remember that a normal 160 to 180 beats per minute ang nakikita nating heart rate at birth. Kasi nga po, the child was exposed to so many amounts of stress and trauma during childbirth, kaya tumataas din po yung kanyang heart rate. But, after 2 to 4 hours, magsistabilize na po yan at magno-normalize din yung kanyang heart rate into 120 to 160 beats per minute. Tama po, yan po ang normal na FHT and yan din po ang normal na neonatal apical pulse or cardiac rate, 120 to 160. Now, the radial pulse is not prominent. It should not be prominent kapag yung patient natin ay neonates or newborns pa lang. Dapat po ay hindi ka nakakaramdam ng malakas na radial pulses sa ating mga pasyente. But, if you happen to check for the radial pulse at na-feel mong ito ay prominent or malakas, this may be indicative of a congenital heart defect which is your patent ductus arteriosus. Meron po siyang condition sa puso na tinatawag natin na patent ductus arteriosus, wherein one fetal accessory structure of the heart failed to close. Kung ito po ay meron kang nafe-feel na bounding or prominent radial pulse, ibig sabihin may sakit po sa puso yung ating pasyente. Now, in the respiratory rate or respiratory effort, you have to remember po that the neonate's breathing is usually rapid, mabilis, irregular, walang pattern, unlike sa ating mga adults na meron siya talagang cycles or patterns. Dito po sa mga neonates natin, irregular po yung kanilang paghinga. It is also shallow or mababaw and also abdominal diaphragmatic. Now, sir, bakit po siya rapid, irregular, and shallow? It is because of the immaturity of the medulla oblongata. The medulla oblongata is the respiratory center that is found in our brain. And since ito ay underdeveloped at immature pa lamang po, it is not yet able to properly control yet the respiration of the neonate. Now, ang normal po at birth na respiratory rate ng ating mga patients is 50 to 80 cycles per minute. So medyo mabilis po yung paghinga ng mga neonates natin at birth. Why? Because they were again exposed to certain amounts of stress and trauma during vaginal delivery or during childbirth. But after they stabilize, naging stable sila after 2 to 4 hours, magiging 30 to 60 cycles per minute na po yung kanilang respiratory effort. Now, you also have to understand na nagkakaroon po sila ng physiologic apnea. Ang ibig pong sabihin nito, this is the normal absence or cessation of breathing that is not more than 15 seconds. Ibig sabihin, titigil po sa paghinga yung bata less than 15 seconds and that is still considered normal. Again, bakit po hindi sila humihinga ng ganoon katagal, less than 15 seconds? Because of the immaturity of the medulla oblongata, kaya minsan tumitigil po sa paghinga yung bata or neonate. Ang tawag po natin doon is physiologic apnea. Now, the physiologic apnea is usually observed during your rapid eye movement or kung saan kung ikaw ay patulog na. Ang tawag po natin doon is your rapid eye movement or your REM cycle. Okay? So, nakikita po natin, pinaka-common ang physiologic apnea during the rapid eye movement wherein the child is going to sleep already. Patulog na po yung bata. Doon po natin pinaka-nakikita si physiologic apnea. The BP of the child, the normal is 75/42 millimeters per mercury at birth, but it will stabilize at birth with a systolic pressure of 60 to 80 and with a diastolic pressure of 40 to 50. Now, an important thing that you need to remember in checking the blood pressure of these neonates is that there should be no difference between the upper and lower extremity pressure. Ibig sabihin, pag chinek mo yung BP dito sa kamay at chinek mo yung BP niya sa kanyang paa, there should be the same, almost the same BP po dapat. Yan ang normal na assessment findings po natin. But if you happen to note a difference between the upper and lower extremity pressures, magkaiba po yung BP sa kanyang kamay at sa kanyang paa, that is also another sign of a congenital heart defect, which is your coarctation of the aorta. At dyan na po nagtatapos ang ating pre-recorded video lecture para sa subject na NCM 107 or Concepts in Pediatrics, wherein we learned about Apgar scoring and the normal vital signs of the neonate. Sana po ay marami kayong natutunan sa akin. Muli ako si Sir Jeff Lay at sana po ay suportahan nyo ang aking YouTube channel sa pamamagitan ng pag-like, pag-subscribe at pag-share sa aking mga contents and lectures. Muli, maraming salamat.